The fact is, it's really difficult to get top-notch, better technology in the US. The most recent example I have this is called the CT calcium score for the heart. So it's supposed to be a low dose. It's used for screening purposes, which means it can't cause harm while you're doing this, which a high dose CT would. So it has to be low dose, probably the same as a few X-rays. My cardiologist friend recommended to me that it's just a few X-rays, but the thing is, it's not. At least not where I am. A lot of X-rays because apparently in the U.S. we don't know that radiation is risky and causes damage. Isn't that funny? I guess a more precise way is to say there's no market for it because doctors and patients alike are both too stupid. Is that any better? I've called multiple places. So here, zero point 0.9 or 1 is probably pretty low, as low as you're going to get. But that's not actually low. Low is zero point 0.3 to zero point 0.5. So why is it that we don't have the capability of doing lower doses? I mean, I'll make some guesses. The first one being that most Americans have no idea what radiation is, nor the risks. In California, there's a law that you have to label how much radiation they got from your imaging study. But I guess it's like the calorie thing. So you put a number out there. What do you do about it? I guess the answer for 99.99% people is nothing. My friend actually was telling me about how he regretted doing it because it gave him radiation risk for nothing. His new doctor told him it was sort of pointless. He was going to have a score of 0, which means you're pretty much guaranteed not to have a heart event for another 4 years. Given all his risk factors and his age, the doctor said you're already going to have a score of 0. I could have told you that. So he regrets it. I have a more useful scenario to use it. My dad, who's quite a few decades older, and does actually have risks, even though it doesn't risk factors because he's old. The problem now is where do I get him a study that has zero point 0.3 millisieverts? So for reference, millisieverts, right? It's a measure of radiation. So for example, X-ray may be like zero point 0.1. So that's not very much. But this should be like a mammogram. A screening mammogram for the heart is the way some people put it. That's how they try to sell it. There's a few different forms of technology. Electron beam is an sort of outdated, old-fashioned form of CT imaging that not many places use anymore, but it's specially designed for this purpose, for heart stuff. One place that has it, they still use a whole lot of radiation. That's besides the point, right? The whole point is you're trying to do something beneficial for people. And I just happen to live and reside in a country where they don't have this available. Isn't that ironic that that's the US? I first started thinking about this when I was in Vietnam, and my wife's dad was getting a CT scan of his lungs. They ordered a low dose CT. I had known low dose CT scans for the lungs to be only for screening purposes, but the doctor was pretty certain. And then I looked it up. Oh, she's right. Low dose CT scans of the lung are sufficient for most purposes. I mentioned this to another friend whose doctor's like, even for CT pulmonary angiograms to look at clots in the lungs, pulmonary emboli. I looked it up. Apparently so. There's even lower doses that they're doing. Here's the thing. I'm going to venture to say these are not commonplace in America, even though they are in other countries. I think even if you go to private places, they're still high dose. They call it low dose, but actually check their numbers. They're all high doses, like above 1. They just think it's a low dose. And slow relative to other stuff they do. But basically, if, you know, everybody is stupid and you are a little bit smarter than a stupid person, are you still not stupid? If you're in a crowd of people whose IQs are well below average, and you get yourself an IQ that's, a little bit below average, I would venture to say, mathematically, you are still below average. So I call many places to try to find out. Private places, academic centers. Stanford, they wouldn't even say a number. They say, hey, no, you wouldn't know until you did it. It's like, that's not true. There's a range. You should know. He said it's low. What does that mean? You're in an academic center, you use the term like low. Low is meaningless. What's the reference range for low? What's the definition of low? There is none. I talked to a physicist at another hospital. He was very helpful. He said, yeah, unfortunately, it's not low. That's just the way it is here in the area. He doesn't know of any place nearby that has low. So that's that. I haven't been able to reach a human being. I haven't been able to reach a human being over like Massachusetts General, an esteemed institution in Boston, Harvard. I don't know what their number is. They put me on to CT Tech, but line kept on ringing. I guess I can try later. But my conclusion is this: medicine in America, a lot of it's not driven by what's actually good for you. A lot of it's driven by money. See, in a hospital, if you work there, that many of our elderly patients don't get walked enough, don't get up enough. The nurses don't really walk them. Therapists do, but sort of they're overwhelmed, understaffed, overstressed. They actually have people to evaluate instead of just walking people. They always say it's a nurse's job. That's true, but the nurse doesn't walk the patient, so what do you want me to do? Most hospitals don't care. A lot of my patients get deconditioned after being here, working them up, fixing them. By that time, they're too weak to go on home. So they go to a nursing home. Skilled nursing facility, rehab is a nicer term that people sometimes use. Basically, they go somewhere, try to get stronger. When the reality is they shouldn't have gotten weaker while they're in the hospital. But again, there's no money. Why does the hospital pay for extra staffing when it's not mandated by law? Oh, because it's better for the patient? Yeah. One place I've heard of that has a walking program is a hospital that got penalized. Well, money. Now you're talking. Let's change something to save money, make money, whatever. Is it just this way in America? So my sense is there's no money in lower dose CTs because all these places in America that are doing them, and people are snatching it up, it seems, have patients who don't know what low dose is, who don't understand the risks of zero point 0.3 millisieverts versus 3 times that. We're talking about young people usually who get these scans, who have decades to live, who may have actual risks from radiation. But the patients don't know any better. Institutions aren't going to tell them. Some doctors may know better, but really don't have any other options. Some doctors may know better and choose not to tell patients. It's a whole gamut. But isn't it awfully sad that in a place where technologically we're supposed to be very advanced, we still manage to hurt people by giving them more radiation they need for a screening exam called a calcium score for the heart or the heart scan, as some people say it. And nothing is going to happen. Nobody's going to do anything about it. And there's no improvement in sight. I guess that's just life in this United States, as the Reader Digest joke sections calls it.